Hello. So we'll be talking about cardiac arrest. Cardiac arrest is when the patient's heart stops beating or pumping blood effectively. In order to recognize this, we'll have to look, listen, and feel to see if the patient's breathing with what we call a head tilt chin lift. This process is only done by advanced rescuers. If the patient is not breathing, the advanced rescuer will then check for the presence of a carotid pulse. After a 10-second check, if the carotid pulse is absent, we recognize our patient is in cardiac arrest. We're not sure what's wrong with them. We're trying to wake them up. Somebody call 911 and get back to me, please. Wake up, wake up. They're not waking up. 2, 1,000, 3, 1,000, 4, 5, 1,000. They're not breathing. Checking the pulse. 1, 1,000, 2, 1,000, 3, 1,000, 9, 10. No carotid pulse. My patient's in cardiac arrest. In which case, if we have an automated external defibrillator or an AED, or better known as a defib, we will then grab the defibrillator, press the button, place the pads on our patient's hairless, dry chest, plug the adapter, and wait for directions. During this time, the advanced responder will open up the oxygen bag, turn on the oxygen cylinder and the regulator, apply the tube to the bag valve mask. Do you have accessibility to a defibrillator? Yes, I do. Somebody call air evacuation or 911. Let them know we have a patient in cardiac arrest. And we have a defibrillator here. We get a hairless, dry chest on our patient. Can I use you as my untrained helper? Can you sit over here?
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Stay right there. Don't touch the patient. Be careful not to touch the patient.
Apply pads, plug in connector.
Watch what I do right after I put the pads on.
Analyzing heart rhythm.
Put the patient, please.
Do not touch the patient.
Once the AED has directed us to press the shock button and begin CPR, we will then begin to train our untrained helper on how to do compressions. And the advanced rescuer will then turn to a bag valve mask, ventilating one breath every 6 to 8 seconds while the helper is compressing consistently without stopping. At that point, we will keep going for a minimum of 2 minutes or until the defibrillator tells us to stop and reanalyzes for a shockable heart rhythm.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Don't touch the patient, please.
Shock delivered. Begin CPR.
Untrained helper, please watch what I'm doing. These are called compressions. I'm going to train you how to do compressions. Make sure everybody can see what I'm doing here. See where my hands are? I'm landmarking. Feel in the center of the chest. Middle finger across the nipple line. Going straight up and down, up 2 inches. Do you see what I'm doing? Sure. You're doing 2 yet after the next cycle. You'll be responsible for taking over chest compressions. Does this make sense to you?
Yep.
Okay, you take over here. Take over. Put the oral airway in. Oxygen's on. 15-liter flow. In the bag here. 1, 1,000, 2, don't stop, 3, 1,000, 4, 1,000, 5, 1,000, 6, 7, 8. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 7, 8. Checking the carotid pulse helper, you're doing great compressions. I can feel the pulse when you do that. 4, 1,000, 5, 1,000, 6, 7, 8. 1, 1,000, 2, 1,000. We're going to keep doing this until the defibrillator tells us to stop and it reevaluates the heart rhythm. So every couple of minutes it'll do this.
Analyzing heart rhythm. Do not touch the
And we'll
patient.
back away from the patient.